and welcome to Fam Health. As most of us know, September 29th is World Heart Day across the globe as part of an initiative to enhance awareness about cardiovascular disease and also to prevent and help manage risk factors associated with heart and cardiovascular disease. This year's theme for World Heart Day is how to make perfect choices in order to have a healthy heart, and also how to use your heart to beat CVD. Today, we have the amazing pleasure of having with us Dr. Naveen Nanda, who will talk to us a little bit about heart health. Thank you so much, Dr. Nanda, for joining us. We know you have a busy schedule and we appreciate you being here. So one of the themes of World Heart Day, of course, is how to use your heart to make better or perfect choices in order to reduce your risk factors of getting cardiovascular disease in the first place. So the first question in terms of making choices is diet and nutrition. What diet choices and what food choices are we making that may be bad for the heart or that you would recommend for a healthy heart?
Well, one way to do the healthy heart would be, one of them would be the lifestyle. Lifestyle changes are very, very important. For example, when it comes to lifestyle, we think in terms of diet. Excuse me, and the diet, when it comes to diet, we all know that plant-based diets are very important, which means if you go more for the plant-based diet, like any vegetables, fruits, those are actually very useful and can ward off some of these cardiovascular diseases. And diet which are very rich in meats, especially red meat, are not that good. And also some of the vegetarian diet is not plant-based, like all the milk products, like ghee and fatty milk, they also should be taken only in moderation. So the emphasis should be on plant-based diet.
Thank you, sir. So we wanted to talk to you a little bit about statins and what role statins play in, helping those who may be at high risk for cardiovascular disease. Could you tell us a little bit about statins?
Statins are very important because they lower the bad cholesterol in our diet. And we know very well from many statins have been around for many years, more than somewhere in the 80s. They were actually, I think, as far as I remember, in the 80s or so, they were introduced. So they've been here for a long time. They have very few side effects. And one of the best drugs you can use to lower this bad cholesterol. Bad cholesterol is the one which actually, predisposes to heart attacks and also stroke because they carry the big cholesterol is deposited in the blood vessels, and as they deposit, the blood vessels get narrowed, and when they get very much narrowed, then of course the blood supply to the area where there is narrowing gets compromised, and if it is in the heart, you get a heart attack. If it's in the brain, you actually get a brain attack, as we call it, stroke. And so that is very, very important when it comes to looking at statins because they prevent this deposition of cholesterol. And also we know that statins, we also know that when there are small fatty plaques in the blood vessels, which all of us get as we get older actually, or if you have too much of fatty diet, even though the blood vessels may not be narrowed too much, but these plaques, which are cholesterol deposition, they can actually rupture. And when they rupture, when they break, the body says, oh, there is something wrong here. So the body tries to actually put clot on it to block that rupture. And when they put the clot on, what it does is narrows the blood vessel. So it's not really beneficial. That leads into heart attack or stroke. So the statins also, we all know that statins also actually have a tendency to make these plaques less vulnerable to rupture. So these plaques do not actually, they tend to prevent these plaques from rupturing. So statins have a lot of benefits.
Sir, another lifestyle related issue that people often speak of when it comes to heart disease is stress. So we just wanted to ask, what role does stress play in heart disease, cardiovascular disease, and how can we manage it?
We all know that stress can actually lead to heart attacks. We know that sometimes if you have a patient, you can tell them to do a complicated mathematical problem, and you can say changes on their electrocardiogram, suggesting they have less blood supply to some heart muscles. So stress actually affects these blood vessels, affects the tone of the blood vessels, and if there is a fatty plaque already there, stress has a direct effect on that. So we know all that. that stress does affect. And of course, one way to alleviate the stress is to actually meditate every day, maybe for half an hour, 1 hour. Yoga also helps, but then some of the yogic exercises may be too complicated for older individuals or individuals with disabilities. But I think meditation, prayer is part of meditation, I think. That can be very helpful.
Thank you, sir. One of the things we also wanted to ask you about was the difference between the genders and heart health, and particularly how heart or cardiovascular disease can impact women, because I think that's something that's often neglected in this country.
Well, I think we used to think, and maybe it's true also, that women, after they enter menopause, which would be in their 50s, then they have a higher tendency of heart attacks. But we have seen young women having heart attacks, especially women who have worked in the call centers. In the call centers, women who work, they tend to have heart attacks, and maybe stress is part of that. And part of that is the sedentary lifestyle, not doing enough exercise, and not actually, and also stress, obviously. And some of them, of course, may have high blood cholesterol also. There's familial high blood cholesterol. Some of them maybe have a tendency to diabetes mellitus. So all that actually can lead to heart attacks in young women. So young women, we should not think that if you're young, you cannot get a heart attack. Young females, young women can get heart attacks, and these are the various factors that can lead to that. So one has to be careful, just like the men, right from younger ages, you have to be careful of. And we know all that heart attacks in India tend to occur earlier in younger people than in the Western countries. And we don't know the reason, but actually that is true. I mean, there's a study which I published a long time ago, when, I think it was in 60s, when probably I was a toddler at that time. At that time, we published a study showing that I could actually get 50, 60 patients who were below the age of 35 and who had actually heart attacks. And so that was one of the earliest studies in India showing the young people actually can have heart attacks. And at that time, we also thought that maybe some of them had arcus senilis, which is in the eye. It's like you get a ring in the eye, like a white ring in the eye. And that ring, we thought could be due to lipid deposition, fatty deposition there, but can also be due to pollution. And I did the study in the King Edward Memorial Hospital in Bombay, which is in the Mill area. And of course, pollution was very high in those days. So pollution could have been a factor also in those days. We also did a study looking at people who had heart attacks, and we looked at blood sugar levels every few days. And that study was published in 1963 in the New England Journal of Medicine. And that study also clearly showed that some of the patients, when the blood sugar was normal, it went up with a heart attack, then came down, but some of them became diabetic. So it looks like we may have a tendency, hereditary tendency to have heart attack. We may be hidden diabetes in us, and stress like a heart attack or any type of stress could precipitate diabetes mellitus. So younger people in India, heart attacks occur in younger people in India, maybe 10 or 15 years before it occurs in the Western countries.
So of course, we are currently in the midst of a global pandemic, and we would be remiss if we didn't get some information from you about coronavirus and the heart and what the linkage is between COVID and heart disease.
Well, coronavirus, the mortality is very high for older people. As you know, that's one very important aspect. People who are above the age of 65 or older, even the mortality is very high. For those who are above the age of 80, the mortality is even very high. Could be something like 40% of them would die or would need ventilation. And so that's one aspect. And the other aspect is, of course, if you have heart disease, like various factors which lead to heart disease, for example, diabetes mellitus, high blood pressure, people are smokers, all those factors, overweight, no tendency to exercise, high LDL cholesterol, all those are risk factors for COVID. But one thing, remember, I need to mention that recently it has been shown that at least there's a tendency that statins actually help with the coronavirus from that point of view. So there is some evidence to that. Of course, it's very, very preliminary, but there is some evidence that statins can help coronavirus. And maybe that's one of the reasons, maybe because it helps with some of these, it reduces some of the LDL cholesterol, could be that.
So one of the other things that we have been hearing about in relation to COVID is something called the cytokine storm. And so when that hits during Corona, it's supposedly, one of the major complications. So we were wondering, statins may help to lower that effect in the heart. So just could you tell us how the cytokine storm impacts us, or how statins impact the cytokine storm?
Very, very recently, I don't remember the exact study, but it has been very recent in the last few days. There is a study showing that statin may have a beneficial effect on coronavirus syndrome and on the CVD. But the thing is, it's still a preliminary study, and of course, more validation will be needed, but at least it makes sense. We know that COVID can affect the heart, especially when there is a cytokine storm. Many of the organs in the body are affected. The heart is affected too. And when the heart is affected, you can actually get what looks like a heart attack. So the plaques actually, there is a theory that the plaques which are lining the cholesterol plaques, the cholesterol deposition, which is lining the blood vessels, they can rupture. And as mentioned earlier, that statins tend to prevent that, right? Has a beneficial effect on the rupture. So it doesn't rupture that often, that much. So maybe that's that could be one of the mechanism. I mean, this is just conjecture, but it'll make sense. As I mentioned to you, it makes sense that statin would help coronavirus syndrome. How much it helps and for how long and which type of patients, we don't know all that.
Thank you so much for your time, Dr. Nanda, and thank you for being with us here today on Fan Health.